Hi, welcome to 5-Minute Physical Therapy. My name's Ethan, and today we're going to be working on the core. I think this is one of the most important areas to work on, especially if you have any back pain, because the core, the internal external obliques, the rectus abdominis, and the paraspinals here in the back, they all work as a stability belt to help support this area. So if you strengthen up the whole stability belt, you're going to help reduce some of that back pain you're having. Now, I'm going to be making other videos on proper lifting mechanics and proper posture that will also aid in helping you relieve some of your back pain. So let's get started. I welcome you to join me. I have 3 exercises. The first one that we're going to be doing is going to be a plank. So we're going to be on our elbows with our feet on the floor, on a yoga mat, or on a table if you have one. And so what you're going to be doing is you're going to go on your elbows, and all you do is you're going to lift up from the toes and keep a straight line. Don't have your butt up in the air and don't have it sagging and arching your back. Really try to tighten this area, okay? Now if this one is too advanced for you, go down to your knees, and there you go. You're doing a plank. And you can alternate in between, so if this one starts to get pretty tiring after like 10-15 seconds, go back to your knees and then you can alternate. We'll do a couple more seconds here. You might be able to tell I'm shaking a little bit. Go back to the easier one and we'll go out of it. So this is an isometric exercise. You're just kind of contracting those muscles and holding it there. Very good, and it works the whole core area. Next, we're going to be doing a very similar exercise, but now we're going to be doing it on the side, so kind of a side plank. This is definitely harder to do at the feet, but you can modify it and have that pivot point at the knees. So the easier way would just be at your knees, lifting up, working this side right here. Holding, having good posture. Don't have the neck all crimped, have it kind of neutral. Don't strain too much. And we'll do the harder one. This is a little bit harder on the shoulder. So if you want to reduce that, go on your knees. It's a little bit less on the shoulder. You can use this other hand to help balance you if need be. All right. And let's do the other side real quick. So we'll do the easier one first, just kind of pivoting on your knees. And then we'll make it a little bit harder. Keeping the body nice and straight, don't sag. Tighten up that core area and just hold. And make sure with all exercise you're breathing. So if you're talking, you're breathing. Sometimes it helps if you want to just count. So if you're counting to 10 seconds, 30 seconds, just go 1, 2, because if you're counting, you're breathing through the exercise. All right, so the next exercise, it's going to be using a stability ball, an exercise ball, whatever you want to call it. But these are going to be kind of dead bug or ball squeezes. So I'll have a link in the description if you want to purchase one off Amazon. They're very versatile. You can do a lot of exercises with them. So with this one, you're going to be on your back. And essentially what we're going to do is with opposite leg and opposite hand. So if this is my right leg, my left hand, you're going to squeeze the ball. That squeezes that front side. And you're just going to squeeze on this. But before you start, you want to make sure you get your back in a good position. Don't have it arched because that's going to put a lot of strain on your back. So what you want to do is flatten your back against the mat or the table, and then release a little bit and then hold it in that position. So you can hold for about 5-10 seconds. Again, this is an isometric exercise. And then we'll switch to the other side. So you can have your foot off, or you can just kind of push with your hand and that will still activate it. So if you can't lift your leg up for some reason, if you're weak, there's ways to modify it. I'll put my legs up because you get a little bit more if you do. And again, breathe. A lot of the core exercises people tend to hold their breath, and with that you're doing a Valsalva maneuver. So we don't want you kind of bursting a blood vessel or putting too much pressure, right? So you want to make sure you're relaxed, breathe, count with the exercise if need be. All right. So those are two great exercises so far. We have the planks and the ball squeezes, both isometric exercises. Now we're going to be doing more of a concentric exercise, so meaning we're going to be moving with the exercise. So specifically meaning shortening that muscle. So this is a little bit advanced. I don't recommend doing this on the table. I recommend doing it on the floor, but for video purposes, I'll just do it on the table. And so again, this is a little bit more advanced, but basically what you're going to do is you're gonna crawl. All right. So getting on the table, this looks kind of dangerous, but trust me, I'm a professional. So basically what you're gonna do is you're gonna bring the knees in on the ball. And again, using those core muscles, tighten them up, don't let them slack. All right, let's do a few more. Don't let that back arch. All right. And then we'll carefully get down. So again, don't do that on a table, but you can do it on the floor. So that kind of concludes those core exercises. You have the planks, you have the ball squeezes, and then you have this a little bit more advanced one where you're kind of putting your knees on the stability ball and bringing your knees up and back. Really focusing on keeping that core nice and tight and keeping your back from arching. So great exercises. You can kind of tell that it was definitely a workout. I thank you so much for watching the video. If you liked the video, please give it a thumbs up and hit that subscribe button. And until next time, thank you.